My name is John Tobias, and I've been a GP here in the south side of Glasgow for 20 years now. In our surgery, we offer very early morning surgeries for patients 2 days a week. My practice nurse, my receptionist, and myself are in the surgery at 6:30. Can I just check your blood pressure again today? Because we found it a wee bit up before. So can we just pop this round your arm?
Yeah.
We recently took part in the Scottish Collaborative where we looked at our workload and how that changed through the week and rejigged our appointment times so that now really we're able to offer access to patients to a doctor within really a few hours of them phoning. But the days of having to wait weeks for appointments are long gone. I mean, we very rarely have to wait more than 24 hours for a patient to see us for a non-acute problem. One area that's changed markedly really is the out-of-hours provision. GPs can now opt out of 24-hour healthcare provision and defer the out-of-hours coverage to an emergency centre via NHS 24. This, of course, leaves the GP more free time, but more importantly means that they're fresh coming into work the next day and not having to be up through the night and then carry on a normal day's work afterwards. This is really a double-edged sword for the patients, I would say. Firstly, the negative side is that they're not going to see their own doctor at night, but it's perhaps unrealistic to expect to be able to see your own doctor anytime, 24 hours a day, 7 days a week. The advantages for the patient, though, are that things being centralised mean they will get a fresh doctor in the emergency centre to deal with their problems. They'll easy access to advice from NHS 24. And of course, NHS 24 and the doctors in the emergency centre and the nursing staff there have access to patient details.
Right, I'm just going to give you your swine flu vaccine.
A lot more of our work is in proactive prevention, running of screening clinics, ensuring that protocols are met, ensuring that targets are met, really going looking for work rather than just dealing with what turns up at the door. A prime example of this, of course, would be the recent swine flu problems that the country's been experiencing. All of a sudden, we had to incorporate into our reasonably busy schedule a fairly extensive vaccination programme, which was different to the seasonal influenza vaccination programme, different set of patients, and with really changing protocols on a day-to-day and week-to-week basis. Fortunately, the swine flu problem was dealt with very well in this practice by using, once again, the integrated team approach. My practice nurse has been instrumental in immunisation programmes. We have used the receptionist and practice manager in the chasing up of patients and inviting them, setting up the recall system for them. And if it wasn't for the fact we had a well-managed and really very well dovetailed together team, I think we wouldn't have coped.
Come in.
Have you got a minute, Liz?
Yeah, sure.
Yeah. Just a wee bit concerned about Mrs. Brown. I've just seen her. Okay. Almost a postnatal depression type picture. Okay. What we do is we work as part of a greater team in the community. This involves working with my health visitor, who has a particular responsibility for the under fives, working with the district nurses, working with the social work department, and many other agencies such as occupational therapy, physiotherapy, etc., that are all brought together. All referrals now are done electronically between ourselves and the hospital. What happens is, supposing I decide to refer a patient to a secondary care professional, perhaps a consultant down at the local hospital, I can dictate the letter, which is digitally transcribed by my receptionist, and the patient will be appointed from there. Gone are the days of having to type out longhand referral letters, sign them, etc., and then send them off and hope they arrive there by post. A lot of people seem to have the notion that GPs don't do home visits anymore. Couldn't be further from the truth.
Hello
Hello, Mrs. McIntosh.
Hello.
Dr. Tobias.
Right.
What actually looking at our working hours has done is freed up time to enable those that need, for medical needs, a visit in their own home, get it. And I do home visits every day, as does my partner. Because a home visit takes considerably longer to do than to see a patient in the surgery, we really have to reserve home visits for patients that are unable to attend the surgery for reasons of need, mainly housebound, elderly, disabled patients, etc. Delivery of healthcare in a patient's home when it's required at that point is still an integral part of general practice. I would like to see that the GP service change in perhaps there's a little too much bureaucracy at present, target reaching, box ticking. I think there's just that's taking a little bit too much of our time, and more time should be devoted to promoting healthy lifestyles. But we mustn't lose sight of the fact that we still need to be available for the acute problems that people do perceive they need to see a doctor about.
Well, I've actually spent quite a bit of time in a surgery with a GP, shadowing them, finding out what they do, and that was organised by the BMA, and that was really positive. But I'm very conscious they see such a range of problems. They work incredibly long hours to ensure that we can access their services, morning, noon and night. And they are very much the front line of the NHS.
The GP to me is the backbone of the NHS. 90% of patient contact with the National Health Service is with the general practice. And I think even more than that, it's the place that you can talk about the family issues, whether it's bereavement or worried about the development of a child. And I think it's the holistic view of the family, but also the services from the health visitor. And I would battle to the end to retain health visitors attached to the general practice.
There's no doubt at all that GPs are absolutely critical to the delivery of healthcare in the community. Going forward, they must clearly, I think, play a greater role in community health and healthcare partnerships, and certainly we would like to see them playing a far greater role in the delivery of after-hours care.
GPs are on the front line of the NHS. They deal with an increasing range of issues on behalf of patients. They're also the gateway to so many other services in the NHS. So GPs are absolutely fundamental to the NHS. They're held in very high regard by patients, and I see the future of GP services as fully part of the NHS family. In Scotland, we want to keep them within the publicly delivered NHS because that's where they belong.